Good evening, all of you. So, welcome to this session of INICET May 2024 Recall of Questions in the Subject of Psychiatry by MedAce team. This happens to be the last session from the MedAce team, and uh, just if some before I start off with the presentation, so if somebody can just put it in the chat box as to whether the video and audio are proper. Right. Thank you. Thank you. Yeah. So, as usual, we start with a disclaimer that all these questions of INICET May 2024 are recall based and hence are not exact in terms of questions and options. And the objective of this session is to discuss the concept that is involved and prepare better for the forthcoming examinations. So, and also I promise you all that in another 30 minutes, I'll be wishing you the good night as well. Right. So, overall, there were around 9 questions in this INICET May 2024. But out of that, so today I am going to discuss about 6 such questions, and 3 questions had interface between physiology, forensic medicine, and general medicine. So there was one question on sexual paraphilias, so which was covered by Dr. Aditya in forensic medicine, and there was one question on EEG, which was covered by Dr. Abhirami in physiology. And there is, as usual, one question from alcohol dependence, which was covered by Dr. Akshay in medicine. So, specifically, there are 6 questions that I'm going to discuss. So, first question: which of the following is not true about rapid cycling bipolar disorder? There might be a words difference because some of the students said that it's rapid cycler. It's fine, it's one and the same. So, options were it's more common amongst males, associated with hypothyroidism, antidepressants usage triggers its occurrence, and at least 4 distinct episodes in the year. So, here a rapid cycling bipolar disorder are kind of a subtype in a bipolar disorder wherein the episodes are rapidly cycling, I mean alternating with, right? So, in that regard, so it is seen that females, so they have the more preponderance in having rapid cycling, and while all other 3 options, that is associated with hypothyroidism, antidepressants usage which triggers its occurrence, and at least 4 distinct episodes in a year are correct. So answer here is more common amongst males because it is more common among females. And the hypothyroidism that is associated with here, so could be due to usage of lithium, because it was seen that people who were on lithium and had a rapid cycling, so they had hypothyroidism as well. So in that context, hypothyroidism, even otherwise hypothyroidism tends to be associated with rapid cycling. The other part is antidepressants usage, particularly the two depressive phase of a bipolar disorder, is seen to be causing occurrence of rapid cycling. So that option. Okay. And by definition, rapid cycling is defined as if there are more than 4 distinct episodes in a particular year. And there is one other component that because it is said here distinct. So by definition, more than 2 months period between the episodes is also one of the diagnostic feature as per the DSM-5. Okay. So in terms of treatment, remember valproate is a treatment of choice, while lamotrigine, carbamazepine, and even at times lithium are used, but preferentially valproate is drug of choice. Okay, right. Next question was, which of the following is not a feature of autism spectrum disorder? So nowadays we are seeing a rise in diagnosis of autism spectrum disorder. Earlier It was referred to as pervasive developmental disorder, or even Asperger's syndrome, Rett syndrome, childhood disintegrative disorder. So all these disorders are currently categorized under autism spectrum disorder. And remember, there is a heterogeneity associated with this spectrum concept. Now, coming to the options here, remember it's not a feature, and few of the students also said that it is not a diagnostic feature. So that makes sense actually, right? So socialization difficulties, restricted interests and stereotypic behavior, intellectual deficits, abnormalities in reciprocal communication. So in this, so there are two major components that you'll have to remember when it comes to autism spectrum disorder. That is social interaction deficits. That is one component. Okay. And restricted interests or behavior. So most of the features stems out from these two entities. Okay, here as we see here, socialization difficulties, yes, it is seen because of the deficits in social interaction, in particular, like recognizing the emotions or maintaining and forming relationships, and also non-verbal communication, body language, gesture, facial expression, all this comes under social interaction deficits that these people might have. Okay, so for them socialization difficulties are seen. Then coming to the restricted interest and stereotypic behavior, so obviously they'll have restricted interest and fixed. At times it seems that some of the children, they just so much preoccupied with the gadgets or even books for that matter, and they have a fixity to a daily routine and rituals. That also comes under this restricted interest and behavior. And some of them also have hypo or hypersensitivity to certain sensory phenomenon. For example, just yesterday we had a child who upon even getting spillage of hot boiling water on his thighs, so he was non responding to it. And same time, there are children with autism spectrum disorder who are so sensitive to sound that even a sound of a whistle of a cooker or even the sound of a barking dog, so will make them panic. Okay, right. So when it comes to abnormalities in reciprocal communication, that's what I was mentioning. So they have difficulties in recognizing the emotions and also reciprocating the emotions. So they have difficulties in reciprocal communication. So the answer is intellectual deficits here. Why? Though there are, it is said that 30 to 40% of the children diagnosed with autism, they do have intellectual disability, but that is not diagnostic. Remember, so these two entities are diagnostic, specific, while intellectual disability and even language development. So language development is one other part wherein many of the children approach hospital or a mental health setup because of the language delay or deviation. But still, that is not so core diagnostic feature of a autism spectrum disorder. Okay, so out of the options, intellectual deficits is the right answer. Okay, right. Moving further, which of the following is not a part of Beck's cognitive theory of depression? Okay, so here it's not Beck's cognitive triad, it is Beck's cognitive theory of depression. So if they had asked for Beck's triad, so just to recap, so it is the negative view of self, environment and future. Okay, so all this stems out because of the model that Aaron T. Beck described. That is, in terms of cognitive distortions, yes. So, like for example, oral overgeneralization, selective abstraction, or catastrophization. So, these are the examples of cognitive distortions. Okay, while automatic thoughts are the ones, negative thoughts which leads on to the cognitive depressive cognitions that we see in patients, and also dysfunctional beliefs. Yes, that is also part of Beck's cognitive theory of depression, while introjection is actually a defense mechanism. Okay, wherein the person internalizes the behaviors or a set of mindset that is seen with the other people. Like for example, if a child has a internalizing of a mother's behavior, that is loud object, as opposed to the people who are traumatized, I mean become victims, they also internalize the accused behavior, right? So that is also called as introjection. So here in this case, cognitive distortions, automatic thoughts, and dysfunctional beliefs, they become part of Beck's cognitive theory of depression, while introjection being a defense mechanism stands out. And remember, CBT, which is cognitive behavioral therapy, is all about addressing these issues, correcting cognitive distortions and dysfunctional beliefs through some of the experiments, and providing them the proof of evidence against their dysfunctional beliefs is a core principle of cognitive behavioral therapy. Okay, hope things are understood better. Right. So there was this question wherein they had asked which of the following are features which are seen in Korsakoff's psychosis. So it seems like they had mentioned about confabulation, peripheral neuropathy, ophthalmoplegia, and amnesia. So the options were either 1 and 2, 1, 2 and 3, 1 and 4, and all the above. So as you can see here, Korsakoff psychosis, which is a complication of untreated Wernicke's encephalopathy, which is seen in alcohol dependent syndrome. Okay, so because of the thiamine deficiency, which happens as an acute deficiency in Wernicke's encephalopathy, goes on to become Korsakoff's syndrome. Okay, confabulation is one important feature that is seen in Korsakoff psychosis, wherein the patient tries to fill in the gaps in the memories. Okay, because they have amnesia. Okay, so while these two are the ones which are seen in Korsakoff's psychosis, peripheral neuropathy and ophthalmoplegia are not specific to the Korsakoff psychosis, though they are seen in alcoholic individuals. Okay, so that's the reason why they sound as a distractors here. Okay, peripheral neuropathy is seen because of it's a kind of a mixed neuropathy that is seen in alcoholic individuals, while ophthalmoplegia, so it forms a triad of Wernicke's encephalopathy. As you can remember, global confusion, ophthalmoplegia, and ataxia. So they are the triad of Wernicke's encephalopathy. Okay, so as confabulation and amnesia are seen, so this option is the right answer here. Okay, right. And there is one other thing I would like to mention here. In terms of Wernicke's-Korsakoff syndrome, if the treatment is not, I mean the patient is not responding to treatment, so there is one other entity called as alcoholic pellagra encephalopathy. Okay, so this is one condition wherein niacin treatment, because it happens because of the deficiency of niacin. So if niacin is given, many of the patients recover, because as we know, Korsakoff syndrome patients are less likely to recover even despite giving months together of thiamine treatment. Okay, in that regard, it interests people that, yeah, those who are not responding, when given a trial of niacin to these people, so they have improved. And one of the key things to notice in people with alcoholic pellagra encephalopathy is myoclonus and hypertonia. Okay, apart from the other features of Korsakoff's syndrome. Okay, yes. Moving further, there was this question on mental health gap action program, in short MHGAP program by WHO, includes all the following disorders except. It seemed like much of the questions asked were in a kind of a negative sense, that yeah, except, not, least. So this kind of questions appeared in with particular reference to psychiatry, or even other questions as well. So here the options were OCD, depression, schizophrenia, and mental disorders of childhood onset. This particular mental health gap program initiated by WHO is for LAMI countries, that is low and middle income countries, okay, wherein the resources are scarce. Okay, in them they had given a framework such that within the limited resources, if the disorders, mental disorders which causes more of a burden, so they needs to be addressed. So in that sense, the gap has to be filled. So in that, as you can see here, depression, this is the priority list given under MHGAP program by WHO. Psychosis, epilepsy, child and adolescent mental and behavioral disorders, dementia, disorders due to substance abuse, all the substances covered, and self-harm and suicide. So these are the priority list under mental health gap program. And it seemed like while recalling, there was one mention that mental health action plan, just shouldn't be confused with, because there is one entity called as comprehensive mental health action plan, which was earlier mentioned as 2013 to 20, and in 2019 again it was extended to 2030, wherein here it is comprehensive package. Comprehensive in the sense most of the disorders are covered, wherein it believes in the principle that without mental health there is no health. Okay, so this is different from mental health gap action program. Okay, right. Coming to the last question here, in which of the following supportive psychotherapy is least useful? So supportive psychotherapy is one form of psychotherapy, okay, which is done when deep or insight oriented approaches or other forms of therapy are not possible. That's a fundamental principle here. Now as we see the options here, it is least useful whether in person with cognitive and functional deficits, or person who is severely ill and uncooperative, person who is motivated and has control over frustration, or acute psychiatric illness with crisis. Okay, so I'll just quote here the exact terms that are given in Kaplan and Sedok's synopsis of psychiatry. So here the indications, okay, so these are the indications: acute crisis, temporary state of disorganization and inability to cope. So persons with these, they are given supportive psychotherapy, or persons with chronic severe pathology with deficient ego functioning, so who tends to have kind of a personality issues as well. So in them, so supportive psychotherapy is indicated, and cognitive deficits and physical symptoms making unsuitable for insight oriented approaches. So in these patients it is useful, while the book also goes on to mention that patient who is available for and capable of more in-depth approach is not actually recommended. Okay, so in that sense, here supportive psychotherapy tends to be useful for persons with cognitive and functional deficits who are severely ill and uncooperative, and also acute psychiatric illness with crisis, because those are the people who are still recovering from a stress, traumatic stress. So in them, much of the therapy cannot be done, only the supportive element that can be catered to. So in that sense, person who is motivated and has a control over frustration, he qualifies for a much better, deeper approach, in-depth approach, and in him it is least useful. Okay, so hope the session was useful for all of you. So totally overall 6 questions were covered. So, and most of them tend to be, I mean, at least one from a community psychiatry or mental health gap program, and the one supportive psychotherapy, which is again considered as a miscellaneous chapter in psychiatry. And Korsakoff psychosis, of course, was a standard topic from alcohol dependence, substance use disorders. And this again Beck's cognitive theory of depression from a mood disorder. And we had from child psychiatry, autism spectrum disorder, and one from bipolar disorder. So remember, so some of the standard topics like bipolar disorder, mood disorders, schizophrenia, so are alcohol use disorders. Definitely there will be one question for sure. So all the best for your preparation for the NEET PG. Thank you for your patient listening. Good night.